What is the best thing to improve scar formation and to make your scar appear better? In this video you're gonna find out. My name is Dr. Alexey Markov. I'm a double board certified plastic surgeon. So let's talk about scars. As a plastic surgeons, we frequently deal with the scars and we try to make them as less noticeable as possible. There are certain ways we can to prevent hypertrophic scar formation or to facilitate better scar formation during the procedure as well as in the post-operative period. Obviously, we always try to hide the scars in the strategic locations, and different people have different tendency to form better or worse scars. Some people have hypertrophic scars or even keloids, and some patients form barely noticeable scars. So first of all, to promote better scar formation, you should have as little tension on the actual skin incision as possible. So frequently, for example, when I do my deep plane facelift, I rely on the deeper structure, deeper tissues to achieve the lift, and the skin just follows passively. So there's very little tension on the actual skin. Frequently for the brachioplasties, arm lifts, thigh lift procedures, or tummy tucks, we rely on the deeper structures such as connective tissue layers to approximate the incision first. So again, there's very little tension on the actual skin closure. I do my skin closures. I tend to use dissolvable sutures. This is one of them called V-LOC 90. The difference with this suture that the suture is actually barbed, has little hooks on the entire length of the suture. And what it does, it helps to distribute tension much more evenly. So there's a nice even tension distribution and kind of zips the incision together. There are no knots, and it helps, I think, in my opinion, to achieve a little bit better scar formation. Dressing is also important. So back in the old days, and sometimes we still do it, people used what's called Steri-Strips. Those little strips, usually made out of paper. Sometimes they enforce, so they have little ridges in them. And this is just a flesh-colored Steri-Strips. It seals the incision and again helps to alleviate any tension. Usually they fall off in a few days. Frequently the patient can shower with them. This is kind of thing of the past. Sometimes people even use the paper tape, and surgeons still use it with a good success. But what I prefer in my practice is usually these two types of dressing, and I'll show them to you. One is just a different type called Liquiband or Dermabond or any skin glue. This is a biological skin glue made out of usually some type of cyanoacrylate, the same compound that actually is in the crazy glue. If you ever used crazy glue in your house, this is actually exact same thing chemically, except this is medically sterilized and prepared for the human use. So I think this helps a lot. Usually this adhesive stays on the skin for a few weeks, and people again usually have different tendencies. Some of them keep this glue longer, some, if you have oilier skin, it usually falls off a little bit sooner, but it helps to seal the incision and to form better scar in the long term. This is a newer type of dressing that I started to use called SYLKE, SYLKE. It's a little adhesive tape, but unlike Steri-Strips, it adheres much better and it's much more elastic. It's woolen, so it stretches and can even put over the joint surfaces. Also, in my opinion, alleviates the tension on the skin edges and helps to form better scar. And then this is also the newer device called BRIJJIT. It's a small company, and they make those little adhesive plastic bridges, and you apply them on the skin edges, and again that helps to alleviate the tension on the skin, on the actual closure, and the scar forms a little bit much thinner. So this is in the immediate post-operative period. How about when you're done with the dressings and you're almost fully healed up? Well, then it's time for silicone. There are different brands, different types, but this is one of them called Silicone. Medical grade silicone is the only thing that was shown in the peer review articles and the studies to improve the scar formation. Back in the older days, we used silicone tape or silicone sheets that you put on the incision. Frequently the patient will sweat underneath, they fall off. Now this is a better alternative, the silicone gel or silicone cream that you can apply over the incision, usually twice a day. You smudge it on the incision, and it coats the scar, it coats the incision line with a thin layer of silicone. And what it does, it keeps the scar hydrated, prevents the oxygen supply, and tends to promote better scar formation in the long term. I also always recommend for the patients to avoid any direct sun exposure with UV, because that can irritate your scar and the scars are not going to look as good. It will also promote activity of melanocytes, so the scars might look a little bit darker. I always tell my patients it takes over a year for the scar to finally mature, because there's a process that happens in the scar where the certain type of collagen gets replaced with another type of collagen. Be patient with your scars. I hope you found this video helpful. Please click the like button and subscribe below.